It is defined as the hypersecretion of tears or decreased elimination. The tear disposal system of the eye that consists of the punctum, canaliculi, lacrimal sac and nasolacrimal duct. The eyelids also form a physiological lacrimal pump. Tearing, a watery eye, may be caused by hypersecretion of tears or decreased elimination, called epiphora. Causes: increased tear production, basal increase, increased parasympathetic drive, from pro-secretory drugs, for example pilocarpine, or autonomic disturbance. Reflex increase, local irritants, for example foreign body, trichiasis. Chronic ocular disease, for example blepharitis, keratoconjunctivitis sicca. Systemic disease, for example thyroid eye disease. 2. Lacrimal pump failure. Lid tone, lid laxity, common involutional change in the elderly. Orbicularis weakness, associated with facial nerve palsy. Lid position, ectropion, most commonly an involutional change in the elderly but may also be cicatricial, mechanical, or congenital. 3. Decreased drainage. Punctal obstruction, congenital, punctal atresia. Acquired, punctal stenosis is most commonly idiopathic but may arise secondary to punctal aversion, post-HSV, herpes simplex virus, infection, or any scarring process, for example post-irradiation, trachoma, and cicatricial conjunctivitis. Canalicular obstruction. Acquired, canalicular fibrosis is most commonly idiopathic but may arise secondary to HSV, herpes simplex virus, infection, chronic canaliculitis, chronic dacrocystitis, cicatricial conjunctivitis, 5FU administration. Nasolacrimal duct obstruction. Congenital, delayed canalization. Acquired, stenosis is most commonly idiopathic but may arise secondary to trauma, post-irradiation, granulomatosis with polyangiitis, GPA, tumors, for example nasopharyngeal carcinoma, and other nasal pathology, chronic inflammation, polyps. Workup. A history of topical medications such as ecothiopate iodide, phospholine iodide, epinephrine, adrenaline, or pilocarpine drops is important, because they may produce lacrimal obstruction. Chemotherapy such as 5-fluorouracil, 5FU, and radiotherapy can cause obstruction in the canaliculi. Photodynamic therapy also has been associated with canalicular stenosis. Dye retention test. The tear meniscus can be seen elevated with fluorescein 2% instilled into the conjunctival fornix when there is delayed outflow. Lacrimal syringing. Jones fluorescein dye test, Jones 1 and 2 dye tests, endoscopic Jones test. Radiological investigations such as lacrimal scintigraphy, nuclear imaging, and dacryocystography. Treatment. Correction of congenital obstruction is typically achieved with a simple probing procedure. For acquired obstructions, a dacryocystorhinostomy, DCR, is usually required for permanent resolution. Thank you.